Welcome to the Nutrition Hero Podcast with Dr. Brad Walsh, making heroes in functional medicine and clinical nutrition. Now, here's Dr. Walsh.
What's up, everybody? This is Dr. Brad with Nutrition Hero. Thanks for tuning in today. I have something special for you today. I was recently out in Denver, Colorado at a seminar, and I was able to track down a presenter, and this is one of the busiest people in functional medicine today, and so I really appreciate that he took time to sit down, even just for 15 minutes, and give me his thoughts on a couple of questions that I had for him. I recorded it because I wanted to share it with you, and so I hope you find value in this today. I have some thoughts after he's done speaking, that some things that I want to highlight that I think you're going to find a lot of value in, as did I. So without prolonging it here any further for you, the gentleman's name is Dr. Bryan Walsh, and Dr. Walsh is doing some things in the functional medicine space right now that have never been done before. He's looking at research in a way that instead of assuming that we're the brightest and smartest people on the planet and we're wiser than the body, he's looking at research through a different lens, and I'll let him communicate some of that to you. But really the challenge for you as we listen to Dr. Walsh just for about 15 minutes here, the challenge is this. I want you to think about, what are your beliefs about the human body? What are your assumptions about health and healing? Think about that as you hear what he's going to talk about here. I was able to corner him at a seminar, and the seminar was on insulin resistance, and I want to get a piece of that here for you also. So without any further ado, here is the quick section with Dr. Bryan Walsh. All right, so Dr. Walsh, welcome to the Nutrition Hero Podcast. I'm glad that you are here today, and I'm honored. I think that everybody else, as we get to the meat of this, we'll see why. So I have a couple of questions for you, and I know you're not prepared for these. I didn't give them to you in advance, which I think is the cool part. And so with that in mind, first question, what do you think the status of functional medicine, clinical nutrition is as a whole, as an industry whole? And second, to piggyback on that, what are you doing specifically to shape that?
Yeah, those are great questions. The state of the industry, I think, is a good one. I think that what we have historically done in clinical nutrition and functional medicine is take the science that's been taught in Western medicine and apply nutritional principles to it. But what I've seen, though, in, I guess, recent years is, while that trend existed a while back, what we're still doing is still using some of that, I guess I'll say now, antiquated information. And in the world of science, it only takes a few years before some information becomes sort of obsolete. And so what I think we're doing now as a whole is what we've been taught in the functional medicine world for the past 20 years, for example. And the research is very clear that we know a lot more about specific mechanisms, specific lab tests, for example, that we can be running that for whatever reason nobody's talking about, nobody's doing. And I don't know why this is the case or why this is happening, but I feel like it's time for an upgrade. And I mean, if you want to say like functional medicine 2.0 or something. And so to answer your second part of your question, that's what I'm trying to do. I spend so much of my time going into the amazing wonderment of what Western science and scientific medicine and conventional medicine has for us in published papers, and trying to bring that to the functional medicine, nutritional medicine space, so that we can upgrade what we're doing. What I believe is that our patients deserve better, especially when there's more information that's already out there, but we're not delivering this. And I don't know why it's not getting out to the functional medicine masses yet. I don't know if anybody's looking at this stuff, but that is my primary goal, is to take this just incredible information that is valid, it is relevant, it is available and out there, and apply it to what we do so that we can offer our patients more. We can get better results than we've already been getting, and arguably we do get great results with the information that we have, but can we get better results, more consistent results, faster results, not make some of the mistakes that conventional medicine is making? And that's essentially what I'm trying to do. I'm just trying to bring this to as many people as I can, because the stuff that I found, quite honestly, is mind-blowing. It's awesome.
So where do you feel like your passion is going to take the industry? And I say that in a way where if nobody's ever heard you speak before, if nobody's heard, like today we're at the Brown Palace in Denver, Colorado, and we're going to be listening to a new paradigm on insulin resistance. If people haven't heard this information before, how is it different? It's cutting edge, yes, but how do they apply it differently to their patient base?
Yeah, that's a good question too. I'll just give you an example. So insulin was discovered in the 1920s, and we're still learning more information about it, to the point that I submit we are somewhat wrong in what we think insulin actually does, which if it's 100 years old almost, you'd think we'd sort of have it down now, but we don't.
Right.
And so what I'm trying to do, and I'll give you just a couple examples about today, for example, is everybody knows that if you have high glucose, you want to try to lower it because it can lead to glycation and macrovascular, microvascular complications and a whole host of different things. But in medicine, which is what we follow kind of their lead. What medicine has done is said, well, if glucose is high and it causes all these problems, let's get glucose down. But there's a number of papers that suggest that maybe that's not the best idea, that maybe insulin resistance is a protective mechanism for cells. Maybe, as I said, that insulin isn't really doing what we thought it did, and there's a whole number of reasons why people may be insulin resistant in the first place. The problem that I see in what we do is if we follow the lead of conventional medicine by lowering glucose, that all we do is we say, well, we're not going to use metformin and we're not going to use insulin, but we'll use some of the cool herbs that we have, when in fact maybe we're making some of the same mistakes. So what I'm trying to do is bring to light this, again, the new information, new theories and mechanisms behind things that we've been looking at for a long time, because that can inform us either are we doing the right thing, or should we be doing different things, or can we augment our treatment protocols so that we're not causing some of the same problems that conventional medicine is causing, for example. And the other one is, are there better ways of evaluating some of these things in the first place? And I use this example in my presentations, but you can have two people that both have high fasting glucose, that they both have a high hemoglobin A1C, but one has low insulin or C-peptide, and the other one has high insulin and C-peptide, and their treatment protocols should be totally different. Yet, if we're not looking at them and the mechanisms as to what's actually going on, we're going to treat them basically the same. We're going to try to lower their glucose. So what I'm trying to do is to like I said, upgrade the theories and the mechanisms so that we can, A, know if we're on the right track. If we're not, we can change tracks and do something else. If we can continue what we're doing, if some of it's right, but make it more tailored, more specific, more personalized for our patients today so that we get better results. And again, try to avoid some of the shortcomings that conventional medicine has done.
So, Dr. Walsh, one of the themes of this Nutrition Hero podcast is really about honoring your body, what's there, and instead of the doctor feeling like they're smarter than that innate thing inside of you that heals the edges of a cut together, what it is about supporting that process. What it is about making sure that you come alongside it and allow it to foster some higher level of expression. And that is what I see in not just the application of the research that you're going through right now, but just the way that you're crafting the message is really not a, hey, I'm smarter than your body situation. It's a, hey, there's this thing that you have inside of you that will heal the edges of a cut together, and we need to figure out what's the knife, what is opening that cut every day. And so I appreciate that, and I'm excited about where it's headed. The other thing that I'm excited about is getting this information into the hands of people that are in the trenches every day, the people that are listening to this podcast, the people that want to be the go-to doctor, the go-to clinician in their community, actually changing the lives of the people in their community. And so when you talk about the mechanisms and we talk about the things that are happening right now in functional medicine and just exactly what you just communicated, is there a message that you would give to somebody that's in the trenches? Is there a message that you would give to the doctor that has the tiny little office out in the remote areas of the states of the United States here? Is there something that you can tell them that, hey, hang on, this is coming, this is awesome, and it's going to change your life? Is there something
like that that is exciting for you right now that you have not yet communicated?
I think I've touched on most of it. Regarding the first point that you said, one of the things that I think that we fail to do as a community, as in all of medicine, is we don't ask enough questions. So you could train a monkey to look at low vitamin D and hit a button and dispense vitamin D.
Right.
The question is, why is vitamin D low? I was out in Orange County a few weeks ago, and I had the same question. I've had this question for years, but in Southern California, where people are essentially half naked most of the year, and
Right.
plenty of sun exposure, they have low vitamin D too. Why are we just looking at low vitamin D and giving vitamin D, and why are we not asking why is it low in the first place? Same could be said for low cortisol. Why is it low in the first place? And to the point that you were sort of commenting on, in appreciating what the body is trying to accomplish, might it be that we're wrong with a lot of this stuff? That if cortisol is low, it's low for a reason, that the body wants it to be low. It's not adrenal fatigue, that the body is suppressing cortisol for a specific reason for survival purposes. Is it possible that insulin resistance is actually an evolutionary benefit for reasons of survival? And the answer to both of those is yes. Just a quick example is iron. If somebody gets a fever, their iron will go low because the body's trying to protect itself from replication of the microbes, for example. So if we were to give that person iron, we're essentially saying, forget what the body thinks.
Right.
I'm smarter than that. And you're going to essentially make the infection worse.
Right, gas on a fire.
Are we doing the same thing by giving vitamin D? Are we doing the same thing by trying to increase cortisol levels in people that it's low? Are we doing the same thing when we're trying to shove glucose out of the bloodstream and into cells so that their A1C comes down and everybody's happy?
Right.
So to all the doctors, no matter where they are, I'm a practitioner too. We get frustrated, and sometimes we can't help people because we don't know all the information, and that's I think my message to everyone is that the information is out there. We're constantly learning more. It's the searching for and applying this information. I will tell you, actually I'll just put it this way. When I read this research, I get so excited about the next patient that comes in that I can apply this to. And we get in a rut. Every practitioner, chiropractic, nutritional, naturopathic, we get in a rut and we think, is this all there is? But what it can take is some new information, exciting information that works better, can revitalize how you feel about your practice, and you get better results. And of course, if you're only seeing, if you're in rural America or anywhere, and you don't have the practice that you want, if you offer things to patients that no one else is offering them, if you're able to tell them things that no one else is offering them, they see that, they get that, they tell their friends about it. You are now unique. You're practicing on a level above everybody else. So I don't know if that answers your question directly, but that's what it is that information is out there. We don't have to get stagnant. We can constantly learn more, apply this stuff, have a better practice, feel more successful. And I'll just say this last point too. I don't know if you've ever done this. I started out way a long time ago as a fitness professional, personal trainer. And I was doing like the hanging leg raises with people and all these things.
That's how I started too, actually.
And then I learned about the importance of the core and abdominals and how I was training everybody's psoas or hip flexors, and I was like, oh my God, I was so dumb. I was screwing people up. I'm making them worse. I'm increasing lordosis, all these different things. Yeah. And that happens in practice too. When I think about how I first started practicing, I look back, I'm almost embarrassed at some of the things that I said or I thought or the way that I treated people. And I feel like that sort of builds up for us, and that we're not confident. We love this medicine. We believe that it works. But when you try something on a patient and it works, why is there some surprise? We're like, wow, that worked.
Exactly. That's interesting that you bring that up. That's really interesting.
And so with this information brings confidence.
Yeah.
Confidence, and one of the things that I present with blood chemistry, for example, is evidence-based reference ranges. And that these practitioners that get these reference ranges based on the scientific studies and not some arbitrary numbers that were just thrown out somewhere, is that they can have the confidence and say, listen, according to these studies, your phosphorus or sodium, whatever it is, your white blood cells, they are high. And here's the studies to back this up. And I'm so confident about this and what this means and what the implications are for you as my patient and what I'm going to do for you, that confidence, patients see that. And they believe you because you believe in the medicine, whereas right now, I'm guaranteeing you that there's some practitioners listening to this that say, well, your glucose is high, let's try this.
Right.
to maybe
Right.
see if this works. How about this works? I
Right.
know that this works. There's both from studies and from clinical experience. So
Right.
so that's what I would say to them, is that the more that you get into the science, the mechanisms, the scientific literature backing this stuff up, the more confidence it breeds. The more confidence it breeds, that translates over to the patients. They see that. They know if you're confident in what you're talking about. I think that that's the real benefit. That's one of the benefits of this.
That's awesome. I think, and if you're listening to this right now and you haven't been hearing it, recognize that Dr. Walsh is living one of our themes for this Nutrition Hero podcast, which is NSL, right? Never stop learning. And when you are in a spot where you're willing to say, I don't know, but I'm going to find out before I go to bed tonight, that will change somebody's life just because you're willing to go on the hunt and figure it out. So, Dr. Walsh, thank you for participating with us today. Thank you for this information. I'm excited about the rest of the day here, learning, and so thank you. Thanks for being part of the Nutrition Hero podcast.
My pleasure. Thanks for having me.
All right.
All right, so you heard from Dr. Walsh there, and I appreciate his time. He's a busy dude, and so when we go through listening to that, one of the things I can't help but think of is this thing where we talk about the golden years of functional medicine. They're just ahead of us here, right? Like, I feel like the last decade in functional medicine has been pretty cool, but I feel like the next decade, the next 10 years is the decade that is essentially going to put it on the map. And not because we're, braver or smarter or anything like that, but because of the systems that have been developed, these evidence-based protocols, these evidence-based assessment models. It is so awesome to see somebody like Dr. Walsh, who is really leading the charge in the research, leading the charge in the critical thinking aspects of functional medicine. It's so fun to see what he's doing as far as the evidence-based programming that we're talking about here. So very excited. It fits right in with the other criteria that we need in order to have the next 10 years be the golden years, right? So we talked about this on previous episodes, but you got to have systems. You have to have approaches that you can take your patients through, that it's systematic approach, not cookie cutter like programming, but a systematic approach to how you analyze a patient case. So cool with that. One of the other aspects of it is making sure that we have evidence-based programs for patients to follow, and they have to be simple enough that the patient can actually get the result they're looking for without having a PhD in nutrition, without having a psychology degree just to get through their day, so to speak. And so I think that's super interesting how Dr. Walsh is talking about piggybacking evidence-based research and protocols with something that puts you in position for success. Now, Dr. Walsh obviously was teaching on behalf of biogenetics over the weekend, and I was fortunate enough to attend. One of the things that he brought up, and this is going to be a future episode in and of itself, but one of the things he brought up over the weekend was this idea that your body is super intelligent, that when you have something like insulin resistance, what if it's there for a reason? Like, what if it's not just a side effect to terrible physiology? What if it's your body, in its wisdom, creating an environment for protection? And so that is really the crux of the matter when we talk about how insulin resistance paradigm is changing in the United States healthcare system right now. And it's people like Dr. Walsh that are really putting the pedal to the metal on this type of thinking. One of the processes that comes out of this is digging into your patient's health history. What are the reasons why the body could be going through insulin resistance right now? What are the reasons that it could be beneficial for a patient? And so I'm going to just continue to leave that thought there for you as you just ponder it, right? I'll have another episode coming up where it talks about insulin resistance specifically, and maybe some of the mechanisms that are causing it, and some of the reasons why it would actually be a beneficial situation. And it sounds super weird to talk about it in those terms after I've spent my whole career talking about insulin resistance from a negative concept. But if there's something beneficial in front of that, do we really want to bully the body into lowering the blood sugar? What if it's elevated for a reason? Now, I understand that high blood sugar for a very long period of time comes with a ton of side effects, and I'm not going to argue that point at all. But in the short term, is there a physiologic reason why the body could desire elevated blood sugar? And if we overlook that reason, are we helping that person, or are we just prolonging the underlying condition? So we'll have all of that and more coming up on future episodes here. Thank you for listening to Dr. Bryan Walsh today on the Nutrition Hero podcast. And remember, until next time, NSL, never stop learning. Never, ever, ever stop learning. Enjoy the rest of your day.